You've spent your whole life hearing that fruit is always a healthy choice. But what if I told you that some of the most common fruits on your table could actually interfere with your medications, and no one warned you? If you're over 61 and take daily prescriptions, this matters more than ever. We're not talking about rare exotic fruits here. These are the ones you probably eat every single week, even with the best intentions for your health and wellness. But certain fruits can quietly block, amplify, or alter the way your meds work, and you may never know until it's too late. If you've been feeling off lately, despite doing everything right, there's a good chance the problem isn't your medicine. It might be what's on your plate, and what you learned today could completely shift how you see your daily routine. Fruit number 1, grapefruit. Let's kick things off with the infamous grapefruit. It looks fresh, it tastes zesty, and it's often the star of a healthy breakfast. But for seniors taking certain medications, this fruit can quietly cause real harm. Grapefruit contains compounds that block a key enzyme in your gut, one responsible for breaking down many drugs. When that enzyme is blocked, your medications can build up in your bloodstream instead of being processed normally. That might sound harmless at first, but it can actually lead to dangerously high drug levels. For older adults whose bodies already process medications more slowly, this effect can be even stronger. It's a silent interaction that can completely change how a medication behaves. And the scariest part, you probably won't notice until symptoms show up. This isn't about scare tactics, it's about informed choices. Common drugs affected include cholesterol medications like statins, certain blood pressure pills, and even meds for anxiety and sleep. Imagine doing everything right with your meds, only to have a morning grapefruit throw it all off. That's the frustrating part. It feels unfair because grapefruit is marketed as a superfruit. But for seniors managing multiple prescriptions, it can quietly sabotage your wellness goals. Let's say you're taking atorvastatin or amlodipine, 2 widely prescribed meds for seniors. Grapefruit can raise their levels in your blood so much that side effects become more intense. Muscle pain, dizziness, low blood pressure, and more. And if you're on blood thinners or antidepressants, the risks can multiply. Suddenly, a fruit that once felt refreshing becomes something you have to question. The key takeaway isn't never eat grapefruit again. It's know when and how to eat it safely. If your meds interact with the grapefruit, timing and portion matter a lot. Some doctors recommend avoiding it entirely, while others might help you space it out. The important thing is to have that conversation. It's your body, and your right to understand how food affects your health. The challenge is, many seniors don't get this info clearly during doctor visits. Either it's rushed or lost in medical jargon. That's why awareness is power. Grapefruit might seem small, but for your body, it can act like a chemical amplifier. The good news? With the right guidance, you can still enjoy a delicious and safe diet. It's also worth mentioning grapefruit juice, which is often even more concentrated. One small glass can have a stronger effect than a whole fruit. And since juice feels less medicinal than pills, we tend to let our guard down. But for someone juggling multiple meds, that glass could be the tipping point, especially when you're trying to do everything right for your heart, brain, and overall health. Some wellness blogs say grapefruit is detoxifying or anti-aging. And yes, it is full of vitamin C and antioxidants. But those benefits don't outweigh the risks if your medications are on the list. That's the catch. Something can be both healthy and harmful, depending on the context. That's why this health tip matters so much for seniors. If you're not sure whether your meds interact with grapefruit, don't guess. Check. A quick call to your pharmacist or doctor can save you a lot of confusion and maybe even a trip to the ER. And write it down somewhere easy to see. As we get older, memory plays tricks, and a sticky note on the fridge can go a long way. Your health isn't just about eating good foods, it's about how those foods play with everything else in your system. Wellness in your 60s and beyond means seeing the full picture. Food, meds, mood, sleep, it's all connected. And small tweaks, like knowing which fruits to watch, can bring huge returns. So next time you see that juicy grapefruit at the grocery store, pause for a second. It might still belong in your cart, or it might not. But either way, now you've got the knowledge to choose. That's what this video is all about, giving you real, useful tools to stay safe, energized, and in control of your health. Fruit number 2, banana. Bananas are often seen as the safe choice. They're soft, easy to digest, and packed with potassium. Perfect for seniors, right? Well, not always. For some people over 61 who are taking certain medications, bananas can quietly throw off your body's balance, especially when it comes to potassium levels, which can rise faster than you'd expect. Let's break this down. Potassium is essential for nerve and muscle function, including your heart. But if you're on ACE inhibitors, like lisinopril, or potassium-sparing diuretics, like spironolactone, too much potassium from food can be risky. It builds up in your blood, a condition called hyperkalemia. And the signs? They're subtle. Muscle weakness, slow heartbeat, fatigue, easy to miss until it becomes dangerous. The problem is bananas are everywhere in the senior's diet, in smoothies, oatmeal, cereal, snacks, even desserts. They're convenient and comforting. So when someone's told eat more fruit, bananas usually top the list. But when mixed with certain meds, they become a silent stressor on your heart. And since the effects take time to show, it's easy to overlook the link. Let's say you're doing all the right things, watching your salt, drinking more water, walking daily, but you're still feeling sluggish or your blood pressure is creeping up. Sometimes it's not your habits, it's the food-medicine combo. And bananas, with their natural potassium punch, can be quietly throwing things out of balance, especially if you're eating more than one a day without realizing the impact. Here's the good news. This isn't about banning bananas, it's about personalizing your wellness. If you're on meds that affect potassium, you might just need to limit your intake. That could mean half a banana instead of a whole, or swapping it out a few days a week for something lower in potassium, like berries or apples. This kind of adjustment doesn't just protect your heart, it empowers you. Instead of fearing foods, you're learning how to work with them. And that's a big deal for seniors who often feel like their bodies are betraying them. You're not doing anything wrong. You just need the right info to make smarter choices for your health. It's also important to remember that your needs can change over time. What worked at 55 might not work at 65. Your kidneys, your meds, your lifestyle, they all evolve. And bananas, while wholesome, might not fit your current balance. This is why regular check-ins with your doctor or a dietitian matter. They help fine-tune the details that really impact your wellness. One tricky thing, blood tests don't always show early potassium problems clearly. You might feel off for weeks before anything shows up on paper. That's why staying alert to your own patterns, like feeling tired after breakfast or noticing heartbeat changes, is key. Your body talks. The challenge is learning to listen. A lot of seniors also take supplements, sometimes even potassium supplements, without knowing it. Combine that with a couple bananas a day, and now you've got a hidden overload. It's no one's fault. It's just a gap in the conversation. And that's what this video is here to bridge. Not with fear, but with clarity and confidence. If bananas are a comfort food for you, that's totally valid, and no one's saying you have to give them up. The point is to see the full picture. Food, meds, and your body all interact in ways that deserve your attention. That's not scary. It's empowering. You deserve to know what's going on inside you. So the next time someone says bananas are great for everyone, you'll know better. You'll know that for some seniors, they require a little more thought. And that awareness, that's a powerful step toward real, lasting health. Fruit number 3, pineapple. Pineapple is sweet, tropical, and feels like a little vacation in every bite. It's packed with vitamin C, supports digestion, and often shows up in fruit salads or smoothies. But if you're over 61 and taking certain medications, especially blood thinners like warfarin, it's time to look a little closer. Because pineapple, as refreshing as it is, can quietly mess with how your body processes those meds. What makes pineapple different is an enzyme called bromelain. It's what gives the fruit that unique tenderizing power. It breaks down proteins. But that same enzyme can also enhance how your body absorbs certain drugs, especially anticoagulants. In other words, it can make your blood thinner too effective, increasing the risk of bruising, nosebleeds, or even more serious internal bleeding. Now, bromelain isn't bad. It actually has anti-inflammatory benefits. But for seniors on daily meds, especially those with heart conditions, stroke risk, or clotting issues, even a small pineapple habit can change the game. And most people have no idea. You eat the fruit, feel fine, and don't connect the dots when a bruise appears or your gums bleed more than usual after brushing. Here's a scenario. You've been managing your blood thinner dosage carefully, getting regular labs, and feeling good. Then, out of nowhere, your INR level jumps and your doctor's concerned. What changed? Maybe nothing, except for that new smoothie recipe you've been loving with pineapple every morning. Sometimes it's the smallest change that makes the biggest ripple. And it's not just fresh pineapple. Juice and supplements can be even more concentrated. A store-bought pineapple juice might look healthy, but it could be dosing your body with bromelain in levels your doctor never expected. That's why seniors on warfarin or aspirin-based meds need to be especially cautious with this sunny little fruit. It's also worth mentioning that pineapple can interact with antibiotics and sedatives, making them either more or less effective. That throws off your whole wellness routine. You're thinking you're doing something good for your health, but your body's internal balance is struggling to adjust. It's frustrating when something so delicious becomes a wild card, right? But let's not overcorrect. This isn't about fear, it's about flexibility. If pineapple's your favorite fruit, don't panic. You might just need to space it out, adjust portions, or avoid it close to your medication times. That's a conversation to have with your doctor, especially if your meds are sensitive to enzyme changes. What's empowering here is knowing that even healthy foods can have complex effects. For seniors, that insight is gold. It means you can stop guessing and start navigating your health with more control. Pineapple isn't the enemy, it's just another piece of the puzzle. And once you see how the pieces fit, things get a whole lot clearer. It's also a reminder that health tips are never one size fits all. Just because pineapple is good for some people doesn't mean it works for you in your current context. That distinction matters more and more as we age. Your wellness plan should reflect your body, your meds, and your goals. If you've noticed small changes, like feeling lightheaded, getting frequent bruises, or bleeding gums, don't brush them off. They could be signs that your medication is acting too strongly. Pineapple might be part of that picture, and now at least you know what to look for. So the next time you're sipping a tropical juice or adding pineapple chunks to your salad, just pause. Ask yourself, is this helping or complicating my wellness routine? That kind of reflection is what takes you from surviving to thriving in your senior health journey. Fruit number 4, apple. Apples are basically the poster child for health. An apple a day keeps the doctor away, right? Well, not always. Especially if you're over 61 and on daily medications. Apples, particularly their fiber-rich skin and the popular cloudy apple juice, can actually block the absorption of certain meds, making them less effective without you even realizing it. The issue comes down to 2 things: soluble fiber and a natural sugar alcohol called sorbitol. Both are great for digestion, sure, but they can slow down how fast your body absorbs medications, especially thyroid meds like levothyroxine, certain antidepressants, and even allergy meds. So you take your pills as prescribed, but they're not really getting where they need to go. That's frustrating and kind of scary. Here's a real-life example. Many seniors take their morning meds with breakfast, thinking they're starting the day right. Then they slice up an apple, maybe add some oatmeal. It all feels healthy, but the fiber in that apple could be binding to the meds in your stomach, preventing full absorption. The result? Fatigue, mood swings, or symptoms that should be under control creeping back in. And if you're drinking apple juice instead, especially the unfiltered kind, it might not block meds the same way fiber does, but it can spike blood sugar fast, especially for seniors managing diabetes or metabolic syndrome. Even worse, many store-bought apple juices are loaded with hidden sugars that counteract your health goals. So while it feels like a clean choice, the effect can be sneakily disruptive. The good news is this is totally manageable. You don't have to give up apples, just rethink your timing. For medications like levothyroxine, most doctors recommend waiting 30 to 60 minutes before eating anything high in fiber. That small adjustment can help your meds work the way they're supposed to. Simple fix, big payoff. It's also worth checking your med list for anything labeled "take on an empty stomach" or "avoid fiber-rich foods around this medication." Those warnings are easy to overlook, especially if you've been on the same meds for years. But our bodies change. What worked at 50 might need tweaking at 65, especially when it comes to digestion and nutrient absorption. Some seniors also add fiber supplements to their routine, like psyllium husk or fiber gummies. Combine that with an apple, and you've got a double barrier to med absorption. Again, not dangerous, but definitely something to monitor. If you felt like your prescriptions aren't working like they used to, this could be one reason why. And let's not forget the skin of the apple. That's where most of the fiber lives. Peeling it can reduce the fiber content, but also cuts back on antioxidants. So it's not about choosing good versus bad. It's about balance. You might keep the peel, but eat it later in the day, long after your morning meds. Little shifts like that make a big difference. What's really important here is paying attention to your body. If you fell off without explanation, don't just chalk it up to getting older. Sometimes it's about timing and food interactions. Apples might seem innocent, but if they're blocking your meds, they're also blocking your progress. This is where personalized health tips come in. You deserve deserve guidance that fits your reality, not just generic advice. And knowing how common fruits interact with your prescriptions puts you in the driver's seat. You're not overreacting. You're taking control. That's powerful, especially in your senior years. So next time someone hands you an apple and says, "This is the healthiest snack you can have," smile. Because now you know better. Sometimes the healthiest choice is knowing when, how, and if it fits your wellness puzzle. And that's real power. Your health after 61 isn't just about eating well, it's about eating wisely. Fruits can be wonderful, but now you know they're not always harmless. The key is to stay informed and make choices that fit your medications, lifestyle, and unique health needs. If this video helped you, subscribe to our channel for more essential health tips designed specifically for seniors. And don't forget to hit the notification bell. This way, you'll never miss insights that could truly change your life. Stay healthy, stay informed, and see you next time.